Q&A, but like a little bit of discussion. I like to hear how these kind of things fit into your life and maybe what you've taken away from these sessions. Today, we are focusing on moving as medicine. So we're focusing on exercise and how it supports arthritis. I will start with just a acknowledgement of traditional owners. So I would like to acknowledge the traditional custodians of the land on which we meet today and pay my respects to elders past and present. Now, with our webinars, we do our best to make sure all the information we share with you is up to date, is accurate, reliable, and it's based on the current evidence base. So we do go through the research and make sure everything's up to date. It's not to substitute any individual treatment advice. If you do have questions that relate to your individual treatments and medications, I will always direct you to your primary healthcare physician or your GP. In saying that, I also try to help out where I can with questions that come in at the end of the session as it relates to our content. So just let a few more people into the room. So in today's session, we will look at the importance of exercise for arthritis. Why is it strongly recommended? We look at the evidence and talk about just some of those key principles of exercise and movement, share some ideas in how we can fit it into our lives more. I know for many of us going into the new year, we always tell ourselves we're going to eat better, we're going to move more, and sometimes the execution might fall through for some of us. So let's look at how we can start increasing that if it's a real struggle point for you. So I've just got here a few misconceptions, and I'm interested to hear from you in terms of if you relate, if you've shared these thoughts before, you still hold on to them. But exercise will worsen my arthritis. Exercise hurts my joints, therefore must be causing damage. Joint pain will inevitably worsen. X-rays are showing bone on bone, therefore I can't exercise. Sometimes we say them out loud, sometimes we keep them to ourselves. We can relate to any of these. Yeah. Hey, fantastic. Just seeing some comments. Also interested to hear from you in terms of what stops you from moving more. Could it be pain? Arthritis is no doubt a painful condition, and that can sometimes impede on our motivation to move more. It's also debilitating for some of us. We can get an enormous amount of fatigue that comes with living with chronic pain, particularly if you have rheumatoid arthritis or an inflammatory type. I know some people describe it as a bus hitting us. Is it fear? We don't want to do more damage to our joints. Yeah, you love knitting and playing the piano, but it hurts your fingers. Yeah. So it's sometimes activities like that. If it hurts then, how can we fit exercise in? Yeah. Just bear with me as I'm letting some more people into the room. Okay. So let's just take a step back. Let's add some context and let's talk about what's actually happening in an arthritic joint. And where I like to start is highlighting that there are different types of arthritis. So the two most common ones we do hear about and ones that afflict most of us, osteoarthritis and rheumatoid arthritis. Maybe I'll allow you to pop into the chat box which one you live with. You might have a different type, psoriatic arthritis, ankylosing spondylitis, gout. So in osteoarthritis, I will focus on osteoarthritis and rheumatoid arthritis, but what's really important to know is that it does extend to the other types of arthritis as well. So the advice, the tips, the research, there's a lot of similarities in terms of how it can relate to us and how it can help us. So I do want to start with osteoarthritis because it is one that affects most of us. What I like to really reinforce is that it's not just a disease that affects the cartilage, it's a disease that affects our entire joint. So we're not just thinking wear and tear of cartilage. This is a disease that affects the bones, cartilage, joint capsule, the membranes in the joint, the fluid, tendons, ligaments, and muscles. It's a lot more than cartilage. Sometimes as we lose that integrity of the cartilage, the bone underneath can become vulnerable, it can thicken, swell, change shape. That can be painful. Some instances we develop bone spurs, which I'm sure you've heard about if you live with this. They can also be painful. What we also see though, we see loss of muscle around the joint. This can result in reduced support, reduced stability, increased risk of injury. And so what I want you to know is that osteoarthritis, it is multifactorial. It's not just bone on bone like we assume it to be. Like people talk about, it's not just wear and tear. It's not just a degenerative disease. It's actually a disease that's influenced by many, many processes, and some of those which can be influenced by change. The part that surprises many people is that the joints are actually designed to move. They're not designed to sit still, and I'll explain why. If you can see here in this joint I'm showing you with my little mouse, I'm not sure if you can see it, but cartilage, it doesn't have its own blood supply. So it doesn't have the little blood vessels that feed it nutrients directly. It needs fluid being pulled in and squeezed out. It needs that movement of fluid to keep the tissues nourished. And so it's as the cartilage compresses and releases, the fluids move in, they move out. It's this very mechanism that is vital for feeding the joint. You also have muscles. These act like shock absorbers. When muscles are strong, they take load off the joint. They absorb impact. They improve alignment, increase stability. It's when the muscles weaken, which can happen very quickly when we avoid movement. It happens naturally as we get older, but the less muscle we have, the more force is going to go directly into the joint. So sometimes the very thing we stop doing to protect the joint, and sometimes that comes about just from not moving, actually makes it less supported. But it's not just mechanical. And this is a part that surprises a lot of people when I talk to them about this condition. It's not just about the mechanics like injury or muscle weakness. We're also starting to learn more about how it's influenced by low-grade whole body inflammation. We know this condition is associated with systemic inflammation, the same type that is involved in conditions like heart disease and type 2 diabetes. And so we have mechanical factors, absolutely, but we also have a level of inflammation that feeds into it. Inflammatory arthritis is different. So this is where we're talking about rheumatoid arthritis, psoriatic arthritis. It's where the immune system becomes overactive. Instead of just protecting you from infection, it mistakenly attacks the linings of the joint. So this attack creates inflammation. This causes swelling, stiffness, pain. So the driver here is immune dysfunction. It's not just wear and tear. Movement during a flare can feel really difficult. It can be really hard if you have that paired with fatigue. This can be tricky, but it does require more caution, more medical management, and movement here can absolutely play a powerful role. So what's important to take away when we are talking about movement and exercise is that pain does not equal damage. Arthritis is a very complex condition. It involves repair processes, muscle strength, inflammation, coordination, but your joints are designed for movement. So the management of arthritis typically involves a very comprehensive approach. If we were to tailor an ideal plan of management that ideally everyone should be getting in care, where the core treatments should be education on the disease, how you should be managing itself, a message around the promotion of physical activity and therapeutic exercise, and there's also weight management if it's relevant to you. So in the first tier of this osteoarthritis pyramid, in every clinical guideline, these things are consistently at the cornerstone of management, and we can be told it's as simple as exercising more or eating a little less. Depending on how you present, there could be more things you do to tweak your management. So if you do struggle with muscle weakness, then focusing more on strengthening could make a powerful impact on your management. If you are above a healthy weight, then targeting weight loss combined with physical activity could be very beneficial for you. And then also if you have poor mood or poor sleep, then targeting CBT and focusing on sleep could make a difference. But we do often hear things like, I'm physically active, I do gardening, I work around the house, but I still have pain. And it's important to note here there is a difference between physical activity, exercise, and exercise therapy. So, just some background, physical activity can be bodily movement that are produced by muscles that result in using energy. Exercise is a subset of physical activity. It's planned, it's structured, and repetitive. Exercise therapy, again, is another subset of physical activity with a very specific therapeutic aims in place, and that's what I'll focus more on. Looking at the second line of treatment here, this can be offered to people who need that additional support. This could be taking pain relief medication in some instances, passive treatments such as physiotherapy, aids such as braces or taping. It depends on if that additional support is required. And just quickly, the third line of management here, I want to be really clear that this isn't intended to suggest this is an outcome, but it does have its place for the right person at the right time, and it can be effective. But it's really important this decision on having surgery is made through that formal decision-making process with your healthcare provider. It's involved weighing up risks and benefits. It's ensuring evidence-based non-surgical interventions, such as exercise, have been explored prior to surgery. So at least you're going into it, you're absolutely certain you've tried everything in your power to reduce that pain, improve mobility. And in that case, surgery is warranted and it can make a very big impact on someone's well-being and quality of life. So, what's important to know is exercise isn't just something that will help. It's supported by hundreds of clinical trials, many systematic reviews, and that's why the current clinical management guidelines are consistently recommended across them as a core treatment. For osteoarthritis, particularly knee osteoarthritis, the evidence is very strong. There was a recent 2025 meta-analysis that looked at over 217 randomized controlled trials. This involved over 15,000 patients. So these trials compared different types of exercise to control groups, and there were very clear benefits that were noted. The most reported improvements were in pain, function, and quality of life. I do have to say the quality of these reviews varied. There was a more recent Cochrane review, which included 139 trials. This involved over 12,000 participants. They found moderate to certainty evidence. So the general consensus here is that exercise can absolutely improve patient-reported treatment success. So in the knee, exercise is one of the most extensively studied non-drug treatments, and the evidence stands in terms of how it can reduce pain, improve function, and enhance quality of life. This is why you see really strong recommendations around it. So it's always a conversation when you're speaking to the doctor. For rheumatoid arthritis, the research base is smaller, but it's still substantial. So in 2025, there was a meta-analysis that looked at 34 randomized controlled trials, and they tested a variety of exercises. This included aerobic exercise, resistance training, yoga, Pilates, traditional Chinese exercise. The findings were very consistent. They were very clear that exercise is safe, it's feasible, and it adds a real benefit, particularly when it's combined with standard medical therapy. Again, this is why you see that general consensus around it being a part of a comprehensive management plan. So in short, exercise, it's not optional. It's a key treatment component for both osteoarthritis, rheumatoid arthritis, and the other types. The recommendations you see in guidelines are directly based on very strong, consistent research. So this study is the one I was mentioning that was published in October 2025. It was the largest analyses ever done on exercise for knee osteoarthritis. It wasn't just one small trial. It combined 217 randomized controlled trials, 15,684 people with knee osteoarthritis. So it's a very strong piece of evidence. They compared the different types of exercise. So they looked at aerobic exercises, which include walking, cycling, strength training, flexibility and stretching, so that being yoga, mind-body exercises like Tai Chi, um, and mixed programs. They did look specifically at pain, physical function, walking ability, quality of life, and they had constant check-ins at 4 weeks, 12 weeks, 24 weeks. In short, medium, longer term insights. This large review actually found that the things like walking, cycling, swimming, so the more aerobic style exercises, led to really large, significant improvements in pain and in the short and medium term. It also improved physical function, walking ability in the medium term, and quality of life in the short term. So this isn't just good advice, it measurably reduces pain. It improves how people move and live. So it led to meaningful changes in people's lives. So we know most types of exercise are good for osteoarthritis and rheumatoid arthritis, but any exercise is still better than no exercise. The two most hyped about in the context of arthritis management do focus more on strengthening exercises and low impact exercises. So when we are talking about strengthening exercises, we're talking about exercises that make your muscles work against resistance. That resistance could be your own body weight, a resistance band, light dumbbells. It could be machines at the gym if you're someone who goes to the gym, even water in a pool. I'm wondering if anyone does our warm water classes here and does hydrotherapy. But examples of these exercises could be going to the gym and doing a leg press machine or a seated row machine. It could include gardening, so getting in the garden and digging some trenches. This is strengthening exercises. It also comes in the form of community or structured options like Pilates. I don't know if anyone does reformer Pilates here. It's actually very tricky. Low impact exercises do include things like walking, swimming, cycling, and it's these activities that keep you moving without excessive pounding through the joints. So strengthening resistance type exercises can be daunting for some people, but there's so many different ways you can achieve it. It's just that movement is essential for your joint health. Low impact exercise also has the benefit that it maintains flexibility in the muscles and connective tissues. So if you're someone who struggles with the stiffness and moving at a certain range, these type of exercises can help those muscles feel less tight. Joints can move more freely, more comfortably. And beyond the joint itself, it does have the other benefits like improving heart health, lung health. If you've been told by the doctor you need to do more cardiovascular exercises, these type of exercises are good for the whole body. So just like medication, we do need that certain dosage to see the benefits. That could be a period of at least 12 weeks and doing an exercise program at least twice a week. But it's something that likely requires that continual maintenance. And this is why it can be really great to speak with your GP, speak with a physio, because they can give you that guidance. The experts in exercise do recommend the strengthening exercises 2 to 3 times a week. But the good thing is even just 20 to 30 minutes a session, focusing on major muscle groups that support your joints can make that noticeable difference. The key here is consistency over the intensity. So regular moderate exercise, strengthening is more effective. It's more safer than occasional heavy workouts. And you can do these exercises at home. You can do them at the gym. You can do it while watching your favorite TV show. Does anyone watch Married at First Sight? You can get the resistance bands and fit it into your nightly routine and then have a cup of tea after. But they can fit into your daily routine. The important part is to keep moving safely and steadily, and your joints will thank you for it. When we do strengthen the muscles, we're not just building muscle for appearance, we're building that joint protection, and sometimes it's that perception we need. Again, the muscles, they act like shock absorbers. When they're stronger, they're able to take that pressure off the joint directly. So having stronger quadriceps can reduce that knee joint loading and knee osteoarthritis. Strong muscles also improve that joint stability. So if you do lack that confidence and you're a bit nervous about moving more because of the risk of injury, and that's absolutely valid. If you also struggle with osteoporosis or osteopenia, this arthritic joints can feel unstable, they can feel wobbly, but having more muscle is absolutely protective. So it can also decrease things like protective muscle guarding and fear-based movement patterns. And this often happens if your muscles tighten around a joint. And it's because your body actually fears it might get hurt. So for example, if your knee hurts, your thigh muscles might tense every time you try to bend it. This can also help with reducing things like flare frequency. Exercise also promotes the flow of joint fluid, which contains those nutrients for cartilage. So it's an essential part of keeping the heart cartilage healthier and the joint healthier. There are the other benefits in terms of helping with maintaining a healthy weight, which we know is a big part of ongoing osteoarthritis management. And that's something we focus on next week is it next week or the week after, when we talk about healthy weight management in the context of arthritis. Reducing that load on weight-bearing joints can have a significant, meaningful impact on your symptoms. So even just small weight loss can significantly reduce pain and stress on joints. So in the guidelines from the Osteoarthritis Research Society, International and American College of Rheumatology, it is suggested that strength exercises produces systemic anti-inflammatory effects as well. So again, there is that inflammatory component, which is important to consider. It's important to know that regular strengthening can help with disease activity. It can help with reducing whole body inflammation. We know that carrying that visceral fat around the belly is a big driver of inflammation. So it can absolutely help with that. In terms of pain modulation, its central mechanisms involve activating certain pain pathways. What this means is that exercise triggers the body's natural pain relief systems, including endorphins. You heard of the happy hormones you can get after going for a run or going and lifting some weights. Over time, this can absolutely lower the perception of pain and improve our tolerance to daily activities. So there are so many examples we could give you to highlight how strengthening exercises could be done, even in the comfort of your own home. And if it's something you are considering doing, not sure where to start, this is where you can actually go onto our website and have a look at the exercise classes we offer. They're very easy to do in the comfort of your own home. But in terms of the lower body, sit to stands are a great starting point. Sitting in a sturdy chair, standing up slowly, then sitting back down. I would do it now, but it's not that great with me sitting in this chair behind this table. But you can start with 5 to 10 reps and do it even while you're watching this webinar. 2 to 3 sets. It works your thighs, your hips, your glutes, but it's a good starting point if you're not confident yet with strengthening exercises. Mini squats, standing with your feet shoulder width apart, bending knees slightly. You don't have to go too deep, but this type of exercise is going to be great for your quads, glutes, hips, and those load-bearing joints. When you have core balance exercises, seated or standing marches, and lifting the knees one at a time. I guess this works your core, your hip flexors, your balance. If you are someone who thrives in a group environment or with supervision, this is where it absolutely is in your best interest to check out some online exercise classes or ask your GP, because they can get you, I'm pretty sure it's 5 free exercise sessions with a physio under Medicare. Low impact exercise, the general consensus is that if it's done on most days of the week, it's going to make a noticeable difference to your joints and overall health. So low impact movement helps the joints in so many different ways. If you think about the cartilage that I was speaking about earlier when I mentioned an arthritic joint and its role, you can think of it as being a protective surface that sits at the end of the bones, but you can think of it as a giant sponge. And I always tell people, think of what you do with a sponge when it's bringing the fluid in and it's being squeezed out. As it's doing this, it's helping nutrients flow into the cartilage and release. It's the mechanism that's absolutely essential for its nutrition. And so it's why movement can actually help with such a wide array of symptoms, but particularly that stiffness. By moving regularly and building that muscle endurance, you can reduce that pressure on your joints. Less compression means less pain as your knees, hips, spine are supported every time you move. Maintaining a healthy weight is one of the best ways to protect the joints, particularly those load-bearing joints like the knees, hips, and spine. If your joints are having to deal with that excessive compressive forces over long periods of time, this can affect things like the biomechanics of the joint. It can cause things like malalignment in the joints. And if this is paired with relatively low skeletal mass, it can lead to negative effects later on. So this is why we talk about healthy weight being a proven effective method for prevention. And then finally, low impact exercise. It does help with a wide array of symptoms I mentioned, like pain and stiffness. Moving gently is what gets the blood flowing. It releases the body's natural feel-good chemicals. Regular gentle movement we know is far more effective and safer than occasional strenuous exercise. So again, these are the exercises we can do in our home, in our garden, in our pool or a local pool, do it on a stationary bike. The important takeaway part here is that it's important to keep moving safely and steadily, and it's the joints that are going to thank you for that. And the thing I personally love about low impact exercise doesn't require a huge amount of effort, even just a gentle walk, a swim, or even some stretching, which I now do with my toddler, lifts my mood, makes me feel less stiff, gives me energy for the rest of the day. It's a consistency that is essential. You can do it anyway. And it's such a great way to connect with your body as well. It's noticing small improvements, celebrating what you can do rather than focusing on limitations. Walking is great, preferably on a flat ground. Exercise, bike, swimming, water exercise, gentle mat Pilates. There are so many videos on YouTube you can get access to. But particularly there are government-funded programs that are available too. So you can check what's available in your area by jumping on Active and Healthy website. They offer such a wide range of programs. If you're in Queensland or any other state, you can jump on the local council website, even if it's just a walking group that you participate in. When you do work with a physio or an exercise physiologist, and again, this is why it can be so beneficial here, you might recognize this picture. So they do teach you how to use something called a pain monitoring system as an indicator of when to modify exercises. For example, if someone is experiencing between a 3 to 5 level of pain, we can continue with that exercise because it's green. If it's yellow, when it's over 5, it's probably a good indicator that we should modify the exercise. Maybe we should move towards an easier exercise, change the position. The key is to, one, connect with your body, but you want to challenge yourself without doing any harm. So that's really important. That's why it can be really beneficial to work with a physio, someone who's trained to understand these cues and teach you how to do so as well. It's really important to also monitor how you feel in the day or two after class. This will absolutely impact the choice of exercise we use. What's really important to know here, though, some pain or discomfort can be normal with exercise. Has anyone here done a workout before and they've felt it in their muscles and they've felt really sore to even just pour themselves a bowl of cereal? It's about challenging yourself in an appropriate way. Mild muscle soreness a day or two after can be a good sign. It can be what we call a good pain. But then you also have bad pain if it's sharp, if it's really achy, if it's like twingy or anything. That's an indicator that you probably want to follow that up. If it's stabbing, sudden, sharp, if it's also paired with like any sign of swelling, if it's hot, if the joint feels unstable, this is your body's way of communicating with you, something isn't right. So you should absolutely stop that activity, or check in with a healthcare professional. So gentle discomfort that improves with rest or stretching is normal. But the pain that's intense, it's persistent, it's unusual, should never be ignored. So it's really about learning to recognize this. So you're challenging yourself, but you're not doing any damage and you're protecting your joints. If you have experienced significant pain with exercise in the past, perhaps it has frightened you from exploring exercise. Again, your GP can connect you with a physio and they can offer you 5 free sessions and you can get a better understanding of the problem and look into it. They're going to help explore different ways you can move, help you nudge the edges of pain, and they're there to work with you to set small, attainable goals so you can gradually work towards them, eventually setting longer term, bigger goals. So your GP can refer you to physiotherapists, exercise physiologists, and there are public health physiotherapy services as well, which you can access through a GP referral. Like in some areas, you might have access to an osteoarthritis chronic care program, which is offered at the hospital. There might be a wait list, so it's always a good idea to see what's available in your local area. And like we mentioned, movement with arthritis can be tough. So it does help to have a mix of those practical strategies and mindset tips, environmental tricks. We've talked a lot about how consistency is really key here. And this is absolutely true when it comes to making lifestyle changes that last. The most important thing isn't how intense your exercise is or how long you push yourself in one session. It's just about making it a regular part of your lifestyle. And you can think of it like being as important as brushing your teeth. You don't skip it for a week and expect and then bring it back in and expect perfect results. It's just about that consistency. Same goes for low impact exercise, just a little bit every day for most days of the week. It does add up. It helps your joints get stronger. It helps your muscles get stronger, makes pain more manageable. Making those lifestyle changes that work for you means finding ways it can fit into your day and your life. And it's about what you enjoy as well. So it could be a gentle walk, it could be stretching while watching TV, short swim at the local pool or the ocean. But the consistency is also what helps build habits and helps see progress. You'll notice over time that your joints do move more easily, they feel less stiff, and you feel more confident in everyday activities. I personally love the idea and concept of habit stacking. Habit stacking essentially just means pairing a new habit, like gentle exercise, with an existing habit you already do every day. By linking them together, it's easy to remember and stick to. So, for example, if you have your favorite show on at every single part of the night, just bringing out the resistance bands, laying down a mat on the floor, or just doing your sit to stands at the couch. It's just about getting your brain to automatically cue the new habits when you're doing the old one, making it less effortful to maintain. Example, you could do a couple of stretches right after brushing your teeth in the morning as well. Your brain will start to make those associations, helping with moving more, making it easier to stick with. I also love the concept of movement snacks, if you've ever heard of it. Think short bursts of activity throughout the day rather than one long exercise session. So it's the snacks that add up and they help maintain that joint mobility, the strength, the energy. Why it helps? It's just even a few minutes of movement several times a day can protect the joints. They can help with circulation, reduce stiffness, and there's probably many, many more that, you could go into detail about. But examples of this could be a 5-minute walk around your garden or home after lunch, 5 to 10 minutes of gentle chair exercises while watching a movie, a few laps up and down the stairs at home if you have them. You could break tasks into manageable chunks as well. Large tasks, and sometimes we probably overestimate our capacity, but large tasks can overload the joints and energy reserves. So instead of cleaning the whole house, try one room at a time. Instead of gardening for 3 hours straight, maybe focus on 20 to 30 minutes of gardening at a time. So this is where we talk about the concept of pacing and something we will focus a little bit later on in our webinar schedule. But in our next webinar, we will be talking more about the concept of healthy weight, how that helps with symptoms, how we can achieve it. If you are interested in learning more about exercise and you want more information, more tips, more tricks, we can encourage you to download Clara or jump onto our e-news, which is where you can subscribe there. Now, it is important to find out from your doctor, what you can do that's going to be beneficial from you. If you do need that clearance, if you struggle with movement already, that's where it's a good idea to maybe speak to your doctor and get some advice. But just know that moving, it does protect your joints, it protects your muscles, it helps maintain that muscle mass. Small, regular activity is way more powerful than we think, can lead to meaningful benefits. Exercise helps with symptoms, and it's the consistency that ultimately matters. Now, I can see we've had a lot of messages pop into our chat box. I'm going to stop our recording here and I'm going to just take a minute or two to just read through some of those comments that have come through.